Hello, and welcome to the very first episode of Steps to Health podcast. Today is February the 19th, a couple of days after our original launch date, but a lot of things have gotten into the way, and that's all right. Here we are, we're doing it, we're going to make it work. I'm so glad you could join us in this very first episode of Steps to Health podcast. Although this is the first episode, I'm actually going to call it episode 0 because it's not technically a full episode. It's just going to be a little mini introduction to myself. My name's Jocelyn. I have been a nurse for just over 11 years. I work in an acute care setting as a registered nurse, though I was a licensed practical nurse for quite a few years there. I currently have a Bachelor of Science degree, and I am incredibly nerdy. I love researching the most random things, especially when it comes to alternative medicines or complementary medicines, things like that. I love to try and prove or disprove what the claims are when it comes to like complementary medicines, and I have a lot of fun with it. And I want to take you along on that journey with me. I also want you to kind of get a better understanding of how your body works. Let's define health together. Let's define what addiction is. Let's explore certain concepts together. That's what this podcast is all about. It's just me having fun, and I'm taking you on the ride with me. One thing I want you to keep in mind is that we need to treat our bodies really nicely. Treat them well. They're on loan after all. What is health? How do we define it? The World Health Organization defines health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. This is a very short and succinct description of health, but there are dozens upon dozens of scholarly papers in many different health care realms: nursing, medical, pharmacological, physical therapy, just to name a few. There are a lot of professions who have tried to define health as an entire concept. Like there are papers, pages long, trying to define what health actually is. So let's explore it just a little bit. You can have a strict anti-inflammatory diet. You can drink a proper amount of water. You can sleep 8 solid hours each night. You can have impeccable dental hygiene and be free of viruses or bacterial infections, but you can still not be healthy. In this hypothetical lifestyle that I just mentioned, your physical health is maintained to the best of one's ability, but what about your mental health? What's that look like? How's your spiritual health? Do you have culture? Are you able to express your culture without fear of being reprimanded? How much time do you get to spend with your loved ones? Are you able to get out of the house? Do you spend any time with nature? How's your ability to cope with stress? There are many different things that affect our physical health without us actually being aware of it. Stress, for example, increases cortisol levels. Increased cortisol levels increases inflammation. Inflammation puts us at risk for many different things. So, yeah, you might be taking care of your physical body, but what about that mental health piece? Health is huge. It's a lot of factors that come together. In a nutshell, it's a combination of internal and external factors that represent your overall well-being. It's contributed to by things such as age, genetics, your sex, your gender, your individual coping mechanisms, unresolved trauma that you might have that you might not even be aware of, viruses or other pathogens that might be in your body right now, your economic status, and your location. You may have free healthcare here in Canada, but how's your ability to actually access that? Do we have enough doctors where you live? Are you able to get to the clinic easily? Like, the list can go on indefinitely. Just some food for thought. Maybe you have a unique way of dealing with stressors or an unusual habit that helps you maintain your own health. If you do, I'd love for you to share it. When I first started learning about health in school as a nursing concept, I'd only thought of health as being like a physical state of well-being. So learning all the different things that can actually impact someone's health and overall well-being just really blew my mind at the time. And I still have a hard time defining health because there's just so many factors. There's no one way to tell if somebody's actually healthy. Health is a concept that we will build upon and build upon more and more as this podcast continues. Not this episode, just the podcast in general. Hopefully we lay down a nice, good, solid foundation for us to build upon. Where were you when you found out that we had a pandemic going on? Further, where were you when you found out that the government was putting in place some social mandates that required us to socially isolate from other people? I bet you know exactly where you were, and I bet you can remember what your initial feelings were about this. Human beings, we are social creatures. So when we take ourselves away from other people, it causes a lot of mental health issues, or it exacerbates the ones that are already there. So this was definitely a huge issue. As you may know, in British Columbia, the number of overdose deaths shot sky high, unfortunately. Our mental health it's a joke. In Canada, we do our best to try and help people with mental health issues, but the funding's not always there. And, addictions is just... it's something that's going to happen. What exactly is addiction, though? Is it people just choosing to get high in order to escape their reality? Or is it people choosing to drink just for fun? In online conversations, I see a lot of people upset with the idea that addiction is a disease. They see it as a choice, and maybe they are right. Those first few times experimenting with substances can be a choice, for sure. Becoming or developing an addiction, however, is not necessarily a choice. This is according to Harvard Medicine, but who's to say that they're more prominent in authority than some anonymous internet voice? A disease, by definition, is an alteration in the way that the body functions. A disease isn't necessarily a virus or a bacterial infection, like one would think. Diabetes, for example, is an alteration in how the body either produces or responds to insulin and glucose levels. It's a disease. Clinical depression is an alteration in the level of certain neurotransmitters in the brain. It's a disease. Anything that changes the way that the body functions is a disease. So much like those examples, substance misuse, which develop over time, create an alteration in the chemistry and the neural pathways of the brain. It effectively changes the function of the brain. When misuse disorder becomes addiction, it is absolutely a disease. Now, I could talk for hours about addiction. I could talk for days about addiction. But I thought starting off with just trying to demonstrate that it's an alteration in how the body functions. It might help you listeners to maybe explain to others or understand yourself that it is legitimately a disease. It's an alteration in how the brain works. It may start off as like a coping mechanism, but addiction is not a choice. People with addictions generally, not always, but more often than not, require an entire team of healthcare professionals to help them overcome this addiction. It is not merely stopping. That's only part of it. The rest of it is treating the physical body, and it's treating the mental health aspect in order to help people overcome it. It's no easy task. If you or someone you know has overcome an addiction, I'd love to hear your story if you're willing to share it. Let me know if you've experienced it or what your thoughts are. Maybe you still disagree that addiction is a disease. Now that heavy topic is out of the way, I know most people have been affected by this pandemic in one way or another, and I don't want to talk about COVID on this podcast. Not right now anyway. I feel like we're all fully saturated with information about it, and it's changing all the time still a year later. But what I do want to talk about is the mental health effects that are coming from this pandemic. How are you doing? How are you? Have you had any time to spend with your loved ones? Have you had to stay inside your house? Have you gotten outside for a walk recently? What have you done to help your mental health? It's super important to try and stay active. It's important to connect with those that you love. And I know it's so hard, but it's the difference between sitting by yourself alone in your thoughts and reaching out to someone who you love and care about. Maybe check on them too. Maybe they would love to hear from you. One thing we can always do to help ourselves feel better is to just get outside and go for a walk. If we can't do that, pick up the phone, make a phone call to someone you love. Get lots of sleep, drink enough water, eat well, and do something you enjoy every day. Don't forget, self-care is incredibly important. And that, my friends, concludes the very first episode of Steps to Health podcast. I hope I haven't bored your ears off just chatting away to myself here. I just wanted to let you know that this podcast has been brought to you by my closet. I couldn't find a good place to actually record it, so I ended up going into the closet, so to speak, not figuratively speaking, like literally I'm inside of my closet. I have my desk set up in here. Originally, I had an office, but I can't use that right now because there's heavy machinery outside my doors. So there's always something that's getting in the way. So I'm glad that I was able to fit my desk in the closet and I was able to record this and get it out there. I can't say I'm totally proud with how this episode has turned out, but I'm just really, really happy that I finally sat down and got it done. And I can't wait for the next episodes because they are going to be much better, a little bit more entertaining, hopefully. And maybe as my editing skills get a little better, we can start seeing better integration of music and entertainment. I mean, I'm sure this was really boring. So if you've made it this far, gosh, thank you so much for listening. I really appreciate it. Let me know what you think. I'd love to hear from you. You can check out my website at stepspodcast.com. And don't forget to subscribe to my YouTube channel, Steps to Health on YouTube. Cheers.